So what are some of the best tips that you and your gang realized along the way?
Sometimes you have a change of schedule during the bone marrow transplant itself. You may leave the hospital early, as I did.
Okay.
So I would say have a person ready to change their schedule if need be. I also found out day one that I came home from the hospital, I had a reaction to medication. I had too much magnesium in my IV and I overdosed. So I had sudden nausea, vomiting, shortness of breath. And my medical oncologist told me to call 911 and I was hospitalized. I would say have names and numbers of the bone marrow transplant oncologist and team with you when you go to the hospital. Have those numbers available for your caregiver at home. Be sure that the patient has a Ziploc bag of all your medications when you go to the hospital.
That's a good one.
Another one I would say is that if you can ask for a home health nurse to be ordered before you leave the hospital, that might be of great help. So she can administer an IV medication if needed through an IV pump.
Okay.
Keep a written report of all the information that you need to record so that when you go to the outpatient visits, you know what's going on and you have recorded it. I would suggest you that if it's okay with the patient, as a caregiver, that you stay with the patient to tell the medical team of your observations and answer any questions that she may have missed. I would also note any medication changes and adjust those medications when you get back home with a pill box so you know exactly what changes there are. So many times there are so many medications that it can
Mhm.
get confusing unless you have two people looking at it.